Today I'm excited to announce that you were named amongst thousands of caregivers in our organization. You're our national award winner today, so I want to say congratulations. One of the things that jumped right out to me, it says she's been doing this for 34 years. She runs a tight ship, and how fortunate we could all be if we had 4 or 5 others just like Denise. And so on behalf of the organization, I just couldn't be more excited and proud to say thank you for all that you do each and every day at Fontanelle. I know you make a difference in the lives of our residents.
Our CNAs are so very important to tuning in to changes with our residents. You're the eyes and the ears for our nurses. Before they're even residents, you know the people in your community and you know who they were and what they did with their careers, and really have built special relationships with them. So thank you very much and congratulations.
I just never dreamed of getting something like this, ever. I mean, I don't know. I just never dreamed this would happen.
She has put in so much time, effort, love, care, and compassion to this community, this building, and these residents.
Oh, she's my right hand. If I need something, she gets it for me. If I need help, she's right there.
I'll take the girls when you get time.
Her loyalty to these residents, to the fellow staff members here, is unwavering.
Amy, you want to check on
anything you need for a question when it comes to resident, she's your go-to. She knows the residents in and out, just really great with the residents, provides great care.
Fontanelle is a very small town. People help one another. I mean, that's the way it should be, and that's how I am, and I like to help people. And I do know most of the residents because they live here in town.
She would go down the hallway and she'd tell me.
She was the lady that had her own restaurant.
This gentleman used to sell insurance.
She was a nurse.
And this lady used to be the bus driver.
And this gentleman was a coach. I guess when you're young, you don't think of things like that, like I'm going to be taking care of this person, or...
I think she probably comes from a more old school mentality. Regimented, and this is the way you do things because it works, and this is the way we've always done it.
Okay, I can do that.
Almost like a drill sergeant.
Some people call me the boss.
You need that, especially when you have so many residents to take care of and going through a tough time like a pandemic. You need leadership at all levels. This resident came up and he wanted to go outside to get some fresh air, and it was my first day here.
He hadn't been here very long, and I got after him.
We're out there for 10 or 15 minutes.
Okay, fine and dandy, the weather's nice. You want to go for a stroll?
We come back inside, and the entire building's on elopement alert.
We didn't know where he was.
She very politely said, "Were you gonna let anybody know?"
Hey, Pam.
I could just tell in her eyes, like, great, we have to work with this guy now.
So you have to tell somebody.
Lesson learned, that's just the type of person she is, and
You want to come sit down?
she loves these residents.
There you go.
Even when she's not working, she'll come out, see the residents.
We did have a couple that lived here, and we took them out like every Tuesday night for supper.
Go out into the community.
They were big into the church, so I took them to like the church supper.
Takes them up to the park.
They were Lions Club members, so I took them to that. Just treat them how you'd want treated, Be kind and, ask them, do you prefer this or do you prefer that? Do you want to stay up late? Do you want to get up early?
Picks out their clothes.
You want to wear a black shirt? You want to wear a blue shirt?
Whatever they need, she's on it.
Put yourself in the resident's shoes, thinking that's you, how would you want to be taken care of?
Feels like family.
Yeah, they do become family.
She's like one of my kids. I think she'd do anything for me because I'd do anything for her.
Being a CNA is tough work. Physical labor of being able to take care of these residents, very taxing position, not only from a physical standpoint, but then you add on the last few years with COVID-19 and just how much that can wear on you mentally as well. And she's always here. She's so devoted to these residents and to this building, this community. It's a very deserving award on her part.
Hip, hip, hooray!